Hi guys, welcome back to my channel. My name is Elizabeth and I am a labor and delivery nurse and I'm a certified childbirth educator, and I am here to do a video on the pros and cons of epidural. So a lot of people kind of going to childbirth, the thing that they're most afraid of, most anxious of is pain. And pain is going to be a part of your childbirth, whether you call that pain or you call it discomfort. And so knowing why people get pain relief, why people choose to abstain from it, can help you make a more informed decision on what your plan is. And also, I think it's important to note that plans can change. So I'm going to give you a whole bunch of information, kind of interlace my personal experiences of having an epiduralized birth and an unmedicated birth with just the general knowledge of what we know are the pros and cons of epidurals. And then we can kind of go from there. So just because you go into labor thinking that you don't want an epidural, if you've never experienced that pain before, it might be something that you change your mind during the process, and that's totally fine. Whether you decide to get an epidural or you decide not to get one is entirely your choice, and as a labor nurse, I'm going to support you in whatever decision you decide to make. I just think it's really important to have the education behind your choices before you're in that situation where you kind of are overwhelmed by the contractions, so that you know what you want to do. And even if you make that choice beforehand and it changes during, that's totally fine too. We're on your team. We are on the same team, girlfriend. So an epidural is an injection of medication. It is either a numbing medication, an opioid, or often a combination of the two. And at my hospital, we use a combination of the two into the epidural space of your back, which is the space before the spinal space and before your spinal column. I'll insert a picture here of where the epidural space is and where that needle is going to be going into. There are three different ways that you can kind of have this epidural block, and it is going to be an intermittent block where they're giving you the medication several different times, doing several different injections. That's pretty rare nowadays. I've never actually personally seen that. You can have a continuous block, which is that there's a pump continually giving you medication. You can have a patient-controlled epidural analgesia, and that is the one where the patient actually has a button and they can press it, patient-controlled, to give themselves more medication. Where I work, we have a continuous infusion and then also the button. So if the patient needs more, they can hit the button and there's a lockout so you can't overdo it, anything like that. So with that epidural, I think most people are afraid of having that really large needle in their back, but it's important to note that the needle goes in and then a catheter is threaded through, and so there's nothing sharp that stays in your back. And I think a lot of people are very concerned about the sharpness in your back. But when you're in labor, the discomfort of getting an epidural, first they numb it with lidocaine, and that honestly is the worst part. That feels like a big old bee sting. And after that, it should just be pressure, and compared to the contractions, an epidural is not very difficult to get for most women. Now I will say sometimes if you've had scoliosis or back surgery, the epidural can be more difficult to achieve and can be a little bit more uncomfortable to achieve, but in general, the getting of the epidural in comparison to full-blown active labor is a lot easier, especially because the end result is going to be that you are no longer in pain. And the epidural, like I said, is the best form of pain control that we have in labor. It's the one that's going to be most used, and it is really good at taking away pain, not as good at taking away pressure. So as baby descends into the pelvis, you might still feel that pressure, but honestly, we like for you to still feel that pressure because that kind of helps you figure out where to push. Because if you're feeling nothing, everything is numb, you can't move anything, it's really hard to figure out where you're supposed to be pushing. So when you're getting the epidural catheter, one thing that can be really difficult is that you have to be still and you have to be in control when they're placing it. And you can't be reaching behind you, you can't be going crazy, and you really have to be in that nice, gonna be in a nice curled up, pushing out your lower back position. And if you can't do that, you can't get an epidural, because it's not going to be safe for them to be coming at you with a needle if you are completely out of your mind, losing control. Most women with the guidance of a nurse are able to really hold that position for the short amount of time that's needed for the epidural to be placed, but that can be one thing that is really difficult with getting an epidural. We're going to go ahead, now that I've kind of explained what an epidural is, talk about the cons or the negatives of getting an epidural. So generally, when you get an epidural, you're going to sign a consent form with the anesthesiologist, which is going to go over all of your risks. But often, because you are in labor, maybe not listening super great to all the risks. So really quickly, anytime that they put a needle in anywhere, there is risk of infection. This is not something that we see happen very often with epidurals. They make sure everything's nice and sterile, and I have never seen an epidural infection, but that is a possibility. Another possibility when putting in the epidural is that it punctures that's into the dura, and you have a leak of spinal fluid. And this isn't going to like horribly ruin anything, but it'll give you a really bad headache when you sit up, because when you sit up, the leak leaks out and your pressure changes in your skull basically, and that can give you a pretty gnarly headache after you deliver. And sometimes they kind of do expectant management and see if that gets better by itself. You also can do a blood patch where you use some of your own blood and actually patch that little leak, but that can be really not fun after you have a baby, to have a really bad headache that gets really bad when you sit up, and when you breastfeed, hold your baby, etc., etc., you're trying to sit up. So that can be another negative of getting the epidural. A third issue can be hypotension. So before you get your epidural, you're going to be getting a lot of fluid through an IV, ideally 1 liter to 1.5 liters of fluid, and that's to pump up that blood volume. So when we give the epidural and everything relaxes and your blood vessels and everything kind of relax, we don't fall into that trap of hypotension. Most of the time when we see that hypotension, we are able to treat it with medications. Rarely it could affect mom and baby in such a way that an emergency C-section is necessary. And so hypotension is another risk. And often mom will kind of feel dizzy, lightheaded, tunnel vision, and then baby will have decelerations, because if mom has a low blood pressure, the baby is also getting less perfusion. So those are kind of the risks that anesthesia will go over with you. There are more kind of just risks in general to your labor and to the safe vaginal delivery of a baby that an epidural can have, and then also postpartum. With that epidural, you are more likely to develop a fever, and the fever is caused by the epidural medications. It's not caused by an infection. But because in labor we can't say, well, that's probably because of an epidural and not because of an infection, we will give you antibiotics more than likely if you get a fever, to protect the baby from any sort of infection, uterine or otherwise. And so you could be getting unnecessary antibiotics because of that epidural giving you a fever. Another pretty obvious issue with the epidural is once you have that, you can't get up and walk. And walking and movement and changing position are all so important during labor to get baby in the very best position possible. Now, your nurse should be changing your position every 30 to 60 minutes based on where the baby has been assessed with their head position, how your cervix is dilating, and if baby's tolerating position changes. And by doing that, we're trying to mimic mother's natural movement in labors. There are a lot of really awesome tools now to help mimic those positions. Peanut balls, which I'll kind of insert a picture of here, can be really helpful. Your hospital might have those. Just being on your side, opening your pelvis, trying to get you into a nice squatting position, a really super upright position, and not just lying on your back. Because if you're lying on your back for your whole labor with an epidural and you're not moving, it's not mimicking the natural way of labor progression, because you would be like, the discomfort makes you move, okay? And that's probably kind of the point too. And so if you're not moving around as you should be, and sometimes no big deal, but sometimes baby can become malpositioned, come down a little bit crooked and not be able to right themselves, and that could lead to increased pushing time, arrest of dilation and descent, and a possible C-section. So that is one big issue with the epidural, is that you can't get up and walk around. Not being able to move and not being able to walk and to turn by yourself means that you need to have a fabulous nurse, which I'm sure you will, who's going to be turning and moving you. And if they're not, ask them to, because that's really important to help your baby come down correctly. The epidural can also cause a longer second stage of labor, and that is that pushing part. Because if you're feeling nothing, everything is numb, you can't move anything, it's really hard to figure out where you're supposed to be pushing. So your pushing can be a little bit longer, and you also, with delivery, have an increased use of vacuums and forceps, which can be perfectly safe and wonderful tools to help get baby out, but if we can avoid them, it's nice because they can cause some trauma to mom and to baby. You also have an increased use of oxytocin or pitocin, which is a synthetic hormone that we use to augment labor. And oxytocin is a safe drug if used correctly. Like any drug, it does have its risks, but when used correctly and titrated appropriately, you should be fine, but it can cause hyperstimulation of your uterus, too many contractions, and your uterus not giving your baby enough of a break, which can lead to decelerations in the heart rate and fetal intolerance of labor. We know that epidurals cause urinary retention during delivery, so you will either need to be in and out catheterized or have a Foley catheter, which is a catheter that's left in your bladder placed. You're not going to feel either of these placements, but they do increase your risk of urinary tract infection. Although because you're not going to have the catheter for a super long period of time, we don't see them a ton, but that is an increased risk. And then after delivery, you can have issues with not being able to void and fully empty your bladder. That last piece of communication that seems to come back after an epidural or spinal anesthesia, which would be used for a C-section, is the brain to the bladder. And so sometimes it's really hard to go to the bathroom, and then once your bladder gets overfilled, it's really hard to empty. It's almost like you need to start back from ground zero. And so you might need in and out catheterization after delivery, and then if you're still not able to pee, a Foley catheter until that sensation is able to come back. And because if you're not able to pee, your bladder can get full, displacing your uterus, your bleeding can actually pick up, which can be a complication as well. So peeing, really important. I go over all of that in my postpartum video as well. You also rarely can have nerve damage from the epidural, and that can cause issues with walking and movement, but again, that is a super rare complication. As far as breastfeeding goes, there is some thought that because the epidural medicine can cross the placenta, that babies are sleepier after delivery. And there also can be some issues because of the fluid boluses that you get with the epidural, that your nipples are a little bit flatter and that there is extra fluid in your breast that makes latching more difficult. The last issue that I also have personally experienced is an issue with having a hot spot. So the epidural, when they place it, they go in blind, and basically they're doing it by feel, and they're pushing sterile water into that space until they get no resistance. That's how they know that they're in the correct space. It also, you don't know exactly which way the catheter is going to be kind of off to one side or the other. Anesthesiologists are great at their job, and that's why they get paid the big bucks. But even with that being said, sometimes you have what's called a hot spot or a one-sided epidural. And this could be due to the catheter being a little bit off or even your back being a little bit funky. With my delivery of my daughter, I had an epidural with a hot spot, and I had one spot where I had no pain control and the rest of my body was nice and numb, and it was horrible because I couldn't get up, I could not move, and that hot spot was just so intense. It's all I could focus on. Fortunately, they were able to give me some more medicine through my epidural catheter to fix that, but sometimes they might have to replace your epidural catheter if that's not working. Okay, so with all that being said, I know that that was a lot of negatives. And I think it's important to be educated, but even with all of those cons, that being weighed to not feeling pain, physical pain and suffering during childbirth can definitely all be worth it for you if that's how you want to feel. So Penny Simkin is a doula, childbirth educator, big birth guru in the birthing world, and she has an idea of pain versus suffering. Always going to be that pain part of childbirth. Having a baby is physically uncomfortable, to say the least, for most people. But there is a difference between having that pain that has a purpose, that you're going to see your baby and bring it into the world, and then having suffering. Mental suffering should not be a part of labor. Labor should be an empowering time for a woman where you are bringing a life into the world and doing amazing things. And when that pain becomes suffering, that is when an epidural is a great tool. Okay, so if you're going into this thinking, I don't want an epidural, and that pain becomes suffering for you, an epidural, there is no shaming that. It is a wonderful tool in our toolbox, a wonderful tool. So even if you just want an epidural because you don't want to have to deal with the physical pain is expected. The emotional and mental suffering should not be. Getting rid of pain is like obviously #1 wonderful part about having an epidural. Another thing that kind of goes hand in hand with that, first time labor sometimes can be a little bit long. There can be a lot of time getting you into that active labor phase, and you could be exhausted. You could have been doing this for hours, overnight, not getting any sleep. So it can be really nice to be able to sleep and have your body do the work while you're sleeping with the epidural. Another thing that kind of goes hand in hand with being able to sleep, obviously, is being able to relax. So some people during labor have a really hard time relaxing. For whatever reason, the contractions have kind of taken control, and it's really hard to get that control back and to help relax your body. And a relaxed body is a body that dilates. So sometimes you get an epidural, you finally relax, and that cervix goes bloop, and it's time to have a baby, which can be really nice. And the nice thing with the epidural too is even if your cervix goes bloop, you can do what we call laboring down and let your body continue to push that baby down to decrease your pushing time. Your nurse will keep turning you to make sure baby stays in a good position. But yeah, you can let the baby come down in the birth canal with just the contractions and start pushing when the baby is a little bit lower, when you have more of that urge to push, which can be really nice, especially for first-time mamas, so that you don't have to push for quite so long. Some women feel that they can be more present for their birth when they're not focused on controlling how they're feeling towards that pain and discomfort with the contractions. With the epidural, you can be really focused on the baby being born. It's easier to kind of help pull the baby up if that's something that you want to do. So some women feel like they are more present during their delivery when they have an epidural. And what can be nice too is that you also can be more present during your delivery. If you have to go for an emergency C-section, they might be able to bolus your epidural so that you are able to stay awake during the delivery and not have to be put to sleep. Sometimes if it really is truly emergent, we gotta go quick, they still will put you to sleep because that's faster than bolusing the epidural and making sure that it's high enough and that you're numb enough. But having that option can be really nice. And then similarly, after delivery, if you were to have an issue with retained placenta, excessive tearing, postpartum hemorrhage, it's really nice to have that pain control when they are manipulating your uterus or having to do an extensive repair on your bottom, not having to get shots of lidocaine with that. Or if you needed to go to an OR to deal with bleeding, to deal with a retained placenta, they're able to use that epidural versus possibly putting you to sleep. Although not all the times, and sometimes they still will put you to sleep. This is all dependent on the doctor's preference. Another time that a epidural can be nice is if you are laboring with twins. So just because one baby comes out vaginally does not always mean that the second baby comes out vaginally. I'm going to do a whole twin video. I'm just compiling research for that. But with twins, if you have the epidural and the second one needs to be a C-section, again, with that C-section bit, you can bolus up the epidural if we can do so safely, we have enough time, and you can more easily stay awake versus having to sit up and get a spinal for the second one. And if the second twin is going to have to be born by C-section, often that is more emergent. So all that being said, I think that epidurals are wonderful tools for labor, and if that is what you choose to do, I think that's awesome. If you're going to want to try and avoid an epidural for whatever reason, let your nurse know what your labor plans are. Let your partner know what your labor plans are. My goal as your nurse is to help you have a happy, healthy, and safe birth with all of your birth preferences, or as many birth preferences as I can, met. That is my goal for your birth. And so talking with your nurse or talking with your partner and having them talk with your nurse when you get to the hospital about what your birth plan and preferences are is going to be really helpful in helping you achieve those. And if they change during labor, that is okay too. Things change, we change, and that's all part of becoming a mother. So this is the second video in my epidural series. My next video is going to be focused on having an unmedicated delivery and a labor nurse's tips and tricks for that, as well as somebody who has had an unmedicated delivery as well. So go ahead and subscribe if you want to catch that one. And thank you so much for watching. Bye guys.